to welcome you to today's forum. The purpose of these regular regional forums is to discuss the impact and our ability to ensure that the upstate is universally recognized as a leading place to learn, live, do business, and raise a family. The mission of 10 at the Top is to foster collaboration, trust, and partnerships across our upstate region, and gatherings like today are an important component of achieving that mission. I want to start off by recognizing and thanking the 10 at the Top board members. If you are here today and you have served on our board of directors in the past or currently, I'm hoping that you will stand because we appreciate your energy and commitment to regional collaborations. Please stand and be recognized. The back of your program includes a list of current 10 at the Top funding partners, and I want to thank each business and organization for providing the support that helps 10 at the Top serve as a regional connector and convener around key issues that are impacting us today and in the future. I also want to thank our sponsors for helping to make today's forum possible. Our presenting sponsor is Blue Cross Blue Shield of South Carolina. Our forum premier sponsor is Brown Mackie College. You'll be hearing from them shortly. Our visionary sponsor is Greenville Health System. Our forum series supporting sponsors are Community Works Carolina, GSP Airport, TD Bank, and the Rutland Institute for Ethics at Clemson University. In addition, we have several other supporting sponsors for today's forum: AnMed Health, Baptist Easley, Bon Secours St. Francis Health System, Christ Church Episcopal School, Genesis Surgical Solutions, Gibbs Cancer Center, and South Regional Healthcare. Let's give them all a big hand. We want to thank these sponsors for recognizing the importance of these regional forums and for helping make them possible. I also want to especially thank Greg Greenewalt and the Crown Plaza for their hospitality in serving as our host for today's forum. Greg, raise your hand and be recognized. Let's give him a big hand. We have been fortunate in recent years to develop an excellent partnership with Brown Mackie College here in Greenville. As mentioned earlier, they are serving as our premier forum sponsor for today's event, and we greatly appreciate all their support and the involvement with 10 at the Top and the Upstate. I am now pleased to welcome Cindy Erb and Fran Eccles to the podium to say a few words about Brown Mackie College.
My name is Frances Eccles, and I'm the department chair for the nursing program at Brown Mackie College. The nursing program started in 2013. We just graduated one class, and we're expecting to graduate another one here in July. Our nursing program is an ADN program, 2 years. Our students are graduating and entering into a 4-year bachelor's program. We are having our students enter into clinical sites around the upstate area, and we're having great success. We're in the middle right now of acquiring our accreditations, which takes a little bit of writing and time, which will offer more opportunities for the school as well.
Good afternoon. I'm Cindy Erb. I'm the program chair and instructor in the Occupational Therapy Assistant program at Brown Mackie. I've been with the program since its start in June of 2011. This topic this afternoon is especially timely and certainly appropriate as we produce wonderful new therapists into this healthcare arena. So we welcome that opportunity to be a part of that here in Greenville area. Also, our students, as you may or may not know, occupation in the word occupational therapy means function. So we restore function when incident or injury, disease process happens, and we are starting with our 8th cohort. So it's very fun, exciting, and we're very, very happy to be a part of your afternoon. Thank you.
scattered in and around if those of you that are at the back would like to come on down and find a seat. At this time, I count it a privilege to turn over the program to our Executive Director, Dean Hybl.
Thank you, Carol, and thank you, everybody, for being here today. We really appreciate you taking the time to be part of this forum series and this event. Many of you have been part of Tent to Talk for a long time and have heard this and probably could give my next 3 or 4 slides, but some of you, in fact a good number today, this is your first or one of your first experiences with our organization. So we always want to take just a quick minute and talk a little bit about who we are and what we do as part of the upstate region. Tent to Talk was formed actually about 10 years ago. Was the first conversations of how can we create capacity in the upstate of all these folks who are working individually across communities or across sectors on issues that are impacting all of us as we're growing today and into the future. Well, how can we create a strong capacity and create opportunities where we're coming together not just when there's a crisis, but at other moments, when there are times that we can take advantage of things instead of only having to react to things. And so the genesis for what has become Tent to Talk started, as I said, about a decade ago, formalized in 2009. At that time, they changed the name from, it was called Upstate Together, and changed it from Upstate Together to Tent to Talk, which stands for 10 counties at the top of South Carolina, both in terms of geography, but we also believe in terms of success. And our mission is to foster and envision an upstate region where collaboration, cooperation, and coordination across sectors and across communities makes us stronger together. And we do that through fostering lots of opportunities to create collaboration, and I'll talk a little bit about that in a second. So basically, in 2010 and 2011, we asked more than 10,000 people, what matters most? What are those things that we need to be working on today and into the future as we look at how we're growing as a community, going from 1.3 million residents in 2010, 1.35 to over 1.62 by 2030. And we came up with the Upstate Regional Vision, focused on our family, our future, and our upstate, working together today for generations to come. And what we do at Tent to Talk is we believe that we have 10 counties, but we have one upstate, and that we are stronger together. And we focus on how can we create collaboration and grow our economic vitality and quality of life. So basically, we do that through a number of things. We create opportunities for our communities and for our stakeholder groups to share ideas, to identify gaps, to increase efficiency, and then to create regional networks and cross-jurisdictional solutions. You can see the 5 driver areas that we focus on: community vibrancy, economic and entrepreneurial vitality, human potential, and natural beauty and resources, and sustainable growth. And so we are about connecting folks, connecting leaders and stakeholders to work collaboratively to make the upstate stronger. How do we do that? Well, we do that through many different small group meetings, large meetings, forums like this one today. We've had since 2010 over 460 such events and engaged about 25,000 participants across the upstate region. And one of the flagship things that we have done is this forum series that we started in 2012. Many of you were with us when we had former governor of Pennsylvania, Ed Rendell, back in April, talk about transportation and infrastructure. Today we're talking about innovation in the changing landscape in healthcare. In September, we'll have Ed McMahon, a fellow from the Urban Land Institute, to talk about economic vibrancy in downtowns and rural communities. And then we always finish the year, and we'll have this event in November with our celebrating successes. We look at great things that are happening across the upstate, organizations that have milestone anniversaries. If you're celebrating a milestone anniversary of 20 years or more as a business or as an organization, let us know, because we like to celebrate and recognize those folks. You can see our core sponsors for the series, and we thank them for their support. And then for today, we have some other sponsors that we certainly thank as well. So our topic for today, innovations in the changing landscape of healthcare. We have been very fortunate that many of the healthcare organizations here in the upstate have been very supportive of the work of Tent to Talk over the years. And we brought a number of those folks together last fall and said, you know, we want to do a forum talking about some elements of healthcare. And as we soon found out, we really could do about 10. because there are so many different components of healthcare, of personal health, of public health, of business health, all these different pieces. But we said we're going to start with, as it works, the innovations and changing landscape. Because we know there's a lot of different things, both challenges and strengths here in the upstate. And here are just a few of the challenges we have as it relates to healthcare. According to America's Health Rankings, South Carolina ranks 42nd amongst the 50 states. Some of the specific high-risk areas they recognize are diabetes, obesity, infant mortality, and high cholesterol. We have an aging population. As many of you know, we are currently about 15% of our residents over the age of 65. That is projected to be 25% by 2030. Now, that's not a bad thing in and of itself, but it does present some challenges as it comes specifically to dealing with health and health care and how we service that growing population. And then, of course, and this could be on any slide for any organization across the entire country talking about this issue, but the challenges around rising insurance and service costs. Certainly something, and some of the innovations you're going to hear about today are things that are addressing that. So while we have challenges, we know we also have strengths. We have upstate hospital systems ranked high nationally. Many of our hospitals are ranked in many different components, and that is a great strength for a region of our size with 1.4 million residents. To have such a great variation of health systems is just very positive for us as a region. The medical industry is a major employer and an economic driver here in the upstate region. It is one of the top 3 or 4 industries and supports our economy in many important ways. The upstate is recognized for medical science innovation. Some of us were in Greenwood at the Genetics Center. Some of you may have been at our forum last fall where the Genetics Center spoke about some of the work they're doing. You're going to hear about some other innovative things today. And then local wellness programs and innovative approaches to healthcare delivery. Of course, Live Well Greenville, they're doing great things with the wellness program in Spartanburg, and many other communities are addressing this issue in innovative ways. So while we have challenges, we also have lots of positive things happening in this industry here in South Carolina, here in the upstate. So that leads to our questions for today. And the first one is, what are local and state healthcare trends? And fortunately, we have Thornton Kirby here to talk about some of that. And really, how does it impact individuals? What are the impacts on our businesses? And then how does it enhance human potential and quality of life for our residents? And then the second question is, how do we leverage the strengths and overcome our weaknesses? And as I said, I think our 2 panels will really do a good job of addressing that and talking about some of the things that are being done to enhance that area.